Want to make sure we don't have any technical issues. Okay. I'm assuming no issues with the audio. I'm kind of bleeding over into Sarah's camera there. So thank you all for having us here today. My name is Brian Holstein. I am the Assistant Director for the Take Me Home Transition Program. I will be presenting in Marcus Canaday's place. So I just wanted to let you all know that I'll be filling in for Marcus. With that,
with the Take Me Home Transition.
we're going to tag team this presentation, provide you all with some basic information about what our program is.
Brian, I'm sorry. I believe
Yes.
we're having some audio issues. We can't hear you.
Oh, okay. I'll try to scoot over.
I'll do it on yours because mine.
Okay, so we'll have to. Can you all hear me better?
Yes, much better.
Is that better? Let's see.
Yes, you're good now.
Okay, good. All right, sorry about that. Thank you, Courtney. All right, and so with that said, we're hoping that you all walk away with a little better understanding about what our program is and what we do. But before we get into the presentation, I just wanted to give a little bit of background about myself. I've been with the Take Me Home program since November of 2012. My background is in social work. Been a licensed social worker for 20 plus years. Just a bachelor's in social work. I have some experience working in doing social services in nursing home, a number of years with the Bureau of Senior Services, and on board here in 2012 in this position. And I can tell you, one of the reasons we do these presentations is our program continuously to evolve for the benefit of our participants and those for the state of West Virginia. And so we do appreciate the opportunity to present our program and this information. So thank you to Courtney and her crew and everyone at the Disabilities Conference for this opportunity. And I think, Sarah, did you want to add anything before we get started?
So Brian and I are tag teaming, so wanted to make sure we had both screens on. So we're having to mute and unmute in between. But I've been with the program, the Take Me Home program, for 3 years. So I'm fairly newer to the program. Previously, I worked for public partnerships with the self-direction program. I was there for 7 years. So I've been in the field for a little while. Prior to that, I was case manager and service coordinator with the ARC of Three Rivers. So I've covered the IDD program, I've covered the age and disabled program, and now working with this program, I also help with the TBI. We don't have very many traumatic brain injury program participants that come through our program, but we have had a few. So we do work with the age and disabled in the traumatic brain injury program regarding with our Take Me Home transition program. So I'm going to turn it back over to Brian.
Okay, please feel free to let me know if there's any issues or any technical issues with audio or visual, but we will go ahead and jump right into this presentation. Go to the first slide. Let's see, you may have to get me. Forgive us, there we go. Okay, a little bit of history about the Take Me Home program. And you can't talk about Take Me Home without talking about Money Follows the Person, which is the MFP. You'll hear us go back and forth between those 3 letters, MFP or TMH. And so we are you'll hear us use that interchangeably throughout this presentation. So a little bit of history about the Money Follows the Person program and the rebalancing initiative. Congress established the Money Follows the Person rebalancing demonstration in the Deficit Reduction Act of 2005. CMS awarded the funds to 31 states in 2007. Also, through 2019, there were 43 states that have participated in MFP and transitioned more than 100,000 individuals through the MFP programs across the country. So the Money Follows the Person rebalancing initiative. The Bureau for Medical Services was awarded the MFP grant by CMS in 2011. West Virginia's MFP program is called Take Me Home West Virginia. And then really the transition program of that, of our Take Me Home West Virginia is called Take Me Home Transition Program. So there's a bit of a distinction there. And currently, there are 33 states around the country that are participating in the MFP demonstration. We expect that number might actually increase due to we've had some recent phone calls with CMS, and they may be allocating monies to the states who had previously participated in the program so that they can get their program back up and running. So that has yet to be determined, but that is something that is in the works. And so we look forward to see if other states get their programs ramped back up again. So the purpose of Money Follows the Person is to support Medicaid programs, and such as here at the Bureau for Medical Services, or BMS, with providing people with long-term care needs a greater choice of where to live and receive those services and supports. Each state's MFP program consists of two parts: a transition program to identify Medicaid members living in long-term care settings who wish to live in the community, and that program helps them do so. And that's really a lot of what we'll be talking about today. And that's a lot of folks, really, if they are familiar with our program, that's the part they're familiar with. It's the second bullet that a lot of folks don't have much familiarity with, and for good reason. It's a lot of things that go on in the background, but that's a rebalancing program through which states make system-wide changes that provide Medicaid members with long-term care needs the opportunity to live and receive services in their own homes and communities if they so desire. And in a nutshell, what that means is that we have some funding and enhanced matches that we get for providing these services in the state that we can use to really make our long-term care programs more robust within the waivers, maybe use some demonstration services to see if what works for folks and what doesn't. And so that really helps us out to really narrow down to what services can make a difference and really streamline our processes and benefit to the participant is the main key. So the MFP transition program is called Take Me Home, or Take Me Home Transition Program. Since the transition program was launched in February of 2013, Take Me Home has helped more than 500 West Virginians transition to the community. Of these, more than 340 participants have completed at least 365 days in the community. Now, that last point there is that 365 days, that is a standard that the Centers for Medicaid or Medicare/Medicaid Services have set as to show as a successful transition. And so that's the standard that we use to determine folks who have completed the program successfully, if you will. So referrals.
Either one, go ahead.
Well, you know what? I'll tell you what, I'll go ahead and do this for this slide here, and then I'm going to hand it over to Sara. But so referrals to the Take Me Home program. Take Me Home will accept referrals on or behalf of residents of long-term care facilities if the resident currently resides in a qualifying institution. And a qualifying institution can be a nursing home, a hospital, or an institution of mental disease. And that's a CMS designation there. The IMD is an area that does require a hard look in order to assist those individuals, but we can, under certain circumstances and criteria, help individuals in an IMD. The second bullet is residents have or wish to transition to a home or apartment in the community. And that home or apartment has to meet certain guidelines. And then the third bullet is the resident is currently eligible or likely eligible for either the aged and disabled waiver or traumatic brain injury waiver programs. And so though that's the criteria to make a referral. And obviously, if there's ever any questions about if somebody who may be interested in the program, but you're not quite sure, you can always give us a call and talk about it, and we'll provide you with the information so that you can make an informed decision on that. And with that, I'm going to mute my mic and hand it over to Sara.
Thank you, Brian. So I'm going to talk about the Take Me Home transition services, and these are services that are provided to individuals wishing to transition back to the community. But oftentimes those individuals, they face numerous obstacles. And some of those include, a lack of funds for security and utility deposits, a lack of basic household items and furniture, limited community supports, and then no one to actually help them develop that comprehensive plan to transition home. So what our program does is we help address those barriers. We help address those needs that the individual is lacking or does not have the ability to obtain. We help address those barriers by providing services and supports to qualified applicants, including the 3 transition services, which would be transition coordination, waiver, pre-transition case management, and then community transition services. Computer has frozen. Give me just a moment. Sorry, guys. Give me just a second. My computer has frozen. Sorry about that. So the first thing that I want to go over is transition coordination, which is the pre-transition case management. And pre-transition case management, I'm sorry about that. So transition coordination is essentially the linchpin of the Take Me Home program. So our transition coordinators, and we do have 5 of those that cover the entire state of West Virginia, they work one-on-one with Take Me Home participants and their transition team to develop person-centered transition plans. And they also facilitate the necessary services to support the individual's transition back to the community. Waiver pre-transition case management is also available to members of the Age and Disabled Waiver and the Traumatic Brain Injury Waiver program to ensure that the direct care services are in place day 1 of the individual's return home. So our transition coordinators work directly with those case managers to make sure that the plans are developed. We do a service plan. The case manager is also responsible for developing the interim service plan for their agency. And it's just outlining all of those needs that the individual has. So that way those needs are going to be met the day that they return home from the facility. Also, there are 2 types of community transition services available. The first one is waiver community transition service, and the second is the money follows the person community transition service. So I'm going to talk a little bit about those. Excuse me. So the first one is the Waiver Community Transition Service. Waiver Community Transition Services, they cover many one-time expenses, as we had mentioned earlier, that are needed to establish a home in the community for the Take Me Home participant. Those include home modifications, moving expenses, home furnishings, essential household items, and then rental security and utility deposits. So in order to qualify for these services, the Waiver Pre-Transition Case Management and the Waiver Community Transition Service, an individual must meet the following criteria. So some of those were introduced already when Brian was talking about how to make a referral for the program. So essentially, to make a referral for the program, some of those same criteria to absolutely qualify for our transition services. So the first one would be to live in a nursing facility, a hospital, an institution for mental disease, or a combination of any of the three for at least 60 consecutive days. The next one is they have to be determined medically and financially eligible for either the age and disabled waiver or the traumatic brain injury waiver program. Third, they must wish to transition from a facility-based living to their own home or apartment in the community, consistent with the Centers for Medicare and Medicaid CMS settings rule. They also must have a home or apartment in the community to return to upon leaving the facility that is consistent with that CMS settings rule. They must require waiver transition services to safely and successfully transition home. And we want to say that they'll reasonably be expected to transition safely to the community with 180 days. So we just assign those timelines so that way, a case is not sitting there stagnant, but we want to make sure that we are moving things along. So we kind of set that internal setting of 180 days to make sure that once that referral comes in, we are getting those individuals home, we're getting them eligible for the waiver program, they're identifying housing, we're getting that home set up for them within that 180-day period. We do, try to move that as fast as possible, but our ultimate goal is to make sure that they are safe in the community when they do return home. So the next one is the Money Follows the Person Community Transition Service, and it's very similar to the Waiver Community Transition Service, but the MFP is a demonstration service that's funded through our grant. And we are able to offer some additional services outside of what's available through the community transition. The first one is assistive technology. We can provide specialized medical equipment and supplies. So oftentimes regarding specialized medical equipment and supplies for individuals that are transitioning home, they're Medicaid eligible for the waiver. So Medicaid is often an individual comes home that immediately that may take a day or two to get everything switched in the system for their Medicaid from long-term care to the waiver. So their Medicaid may take a moment to activate. So there may be durable medical equipment that they need the minute they go home. And one of those things that we have found is incontinence supplies. Oftentimes the social worker at the facility will set up, put an order in, and those incontinence supplies will be ordered for the individual, but they may not be there the day that they arrive home. So we can under the MFP community transition, we can provide that initial supply of incontinence supplies, so that way when they go home, they are ready to go. And then once the supplies are ordered through Medicaid, then they can be on that continuous ordering of that and supply of that. The other thing that we can provide under MFP community transition is transportation. We also can provide an initial food supply, and this is available after the public health emergency. I'm going to talk about that in just a moment. And then the other thing is just miscellaneous transition support services. This is just kind of a catch-all service. So if there's something that the individual absolutely needs to transition home, it's within the budget that's allowable, and we can get permission for that, then oftentimes that may fall under that miscellaneous transition support. So if it's something that an individual would need to go home to make sure that they are safe, that doesn't fall under the waiver community transition. It doesn't fall under assistive technology or transportation, but it is something that is necessary. Then we would review that on a case-by-case basis, and that would fall under that bottom category. So some additional services that are also available outside of the waiver and the MFP community transition are grant-funded services that fall under the MFP, but again, they're not community transition. They would be home modification. And if you guys remember, home modification is actually available under the waiver community transition service, but we can also provide it under the MFP grant as well. So it just actually provides additional funding. Oftentimes for home modifications, that's a large expense. It's something, even for a ramp, the building of a ramp can be a large expense. So we want to be able to access services through the waiver community transition, but then they can also access funding through the MFP services to help pay for that. The other thing that we can provide under the demonstration program are COVID-related services, which include pantry stocking. And as I mentioned on the previous screen, we can provide initial food supply as an MFP service, an MFP transition service, but we can also provide under just the demonstration, the pantry stocking. So while we are currently under the pandemic, we can provide up to 6 months worth of pantry stocking. So each month, the beginning of every month for an individual who's transitioned home, we have a limited budget that we can provide them food supply for each month up to 6 months until the end of the pandemic. And then once the pandemic is over, then it would roll back to just that initial food supply, and we can provide that service just as a one-time thing. Other COVID-related services are internet access fees and equipment, such as a tablet to access the internet. We've been under the pandemic for 2 years, so we've learned a lot, but a lot of those things, one of the changes that seems to be utilized a lot is telemedicine and telehealth. So being able to provide an individual who's transitioned home a tablet or internet access that they would not otherwise have the funding for has a benefit for our individuals. And then the last thing we can provide under the MFP demonstration service is a personal emergency response system. And for most individuals that are transitioning home under the Take Me Home transition program, we do provide that personal emergency response system for every one of those individuals. So as I mentioned too, we have 5 transition coordinators that cover the entire state. So below is a list of those individuals, the region that they cover, and their names. So Sam Ball covers the southeast part of the state. Paula Corley covers the northern panhandle. Gina Fisher covers the southwest. Autumn Hager is north central, and Josh Phillips, is the eastern panhandle. And on our website, their contact information is also listed. So if you would need to get in touch with them individually, you could access that information. So the transition coordinator, just to kind of give you a background of what they do, they require the collaboration and coordination of many moving parts. So all of which must fall into place on or immediately before the transition day. So again, we want to make sure that the needs of the individual are met the day that they go home, that they have staffing available, whether that be a formal support or whether that be an informal support, but we want to make sure that their needs are met the day that they go home. So they're not only the catalyst for that collaboration, but they're the glue that holds it all together. So they are working with the people at the facility, they're working with the housing manager in the community, they're working with the individual's family, they're working with the individual themselves primarily to make sure that they know exactly what they need when they go home and who's going to provide that need. So the role of the transition coordinator, and this just kind of gives you a breakdown of everything that they do. So they're responsible for accepting and following up with referrals. They're conducting the face-to-face interviews with the applicants. Now during the pandemic, most of those were either video conference or teleconference, but we are hoping, providing that the COVID numbers stay down, we're hoping to get back in the facility starting in July. So that way they can conduct those face-to-face interviews with the applicants and share information about our program, share information about resources in the community. But they're also responsible for assessing the residents' readiness to begin the transition assessment period. They're going to talk to them and say, okay, what are your needs? How can those needs be met? What are you looking for to go home? Do you need an apartment? Do we need to apply? Or do you already have a home to return to, but you need some modifications? So they're really just sitting down and kind of working through what the individual needs. They're also going to look at the risk factors that may jeopardize a safe and successful transition. So, somebody has a home to return to, but they really have no informal supports around. They live in a very rural area. So finding formal staff may be an issue, but how can we address those risks? So can we look at assistive technology to make sure that that individual is covered when a staff person is not there? They're also responsible for facilitating the development of a transition team, which is going to include the transition coordinator themselves, oftentimes the facility staff at the nursing facility, the resident themselves, and then anyone else that the resident chooses to participate in that transition process. They work with the resident and their transition team to develop that written transition plan that incorporates the specific services and supports to make sure that those needs of the individual are met. So they also conduct a risk analysis, and they're going to develop that written risk mitigation plan that's going to address and monitor all those identified risks. So when they sit down with that individual and they're going to look at, okay, they have a home, but it's in a rural area, how are those risks going to be addressed? They put it all into a risk mitigation plan, and that's provided to the individual, that's provided to the family, and also provided to the case manager, so that way it's available in the event that something would happen. Everybody kind of knows the process and how to follow it. They also facilitate the procurement and delivery of needed services and supports, and all of those services that we talked about, the waiver transition services, the MFP community transition services. So they're making sure that all of that stuff is in place and it's documented in the plan. They're also going to conduct outreach and serve as a liaison with the nursing facilities and foster effective communication with the facility staff and troubleshoot any issue may create barriers. So they're going to go out, and not only are they going to work directly with the social worker, but they also may work with the director of nursing. They may work with the administrator just to let them know what our program's about, help encourage future referrals, answer any questions that they may have, just to kind of make sure that everybody understands what our program's about, but also talking with the residents at the facilities and their families. They're also going to work with the waiver case management and the PPL resource consultant on any identified needs post-transition. So our transition coordinators, once they help an individual transition home, they don't do monthly follow-up with that individual, but they do make sure that they have their contact information. They check in with them a week after transition to make sure that they are settled, make sure everything is in place. If they need anything, then they, will follow up on that. But they also work with that waiver case manager, so that way, if 3 months down the road a new need comes up, there's still money left in their budget, they can send in that request for something that that participant may need, or maybe a need has changed and it wasn't originally thought of from the beginning. There's still money available, so they're going to work with that case management or that resource consultant to make sure that that need is addressed and identified and fixed. So I'm going to turn it over to Brian, and he's going to talk with you a little bit more about what that person-centered transition team looks like.
Okay, thank you, Sarah. All right, yeah, Sarah mentioned earlier when she was talking about the transition coordinators, one of those items that she addressed were the transition team. And the transition coordinator is really there to help the participant identify those individuals who they would want to sit on their transition team, basically to provide input. And so this next section, we're going to talk about a person-centered transition team. So the transition process belongs to and must always be driven by the Take Me Home participant. And I'm going to say that one more time. The transition process belongs to and must always be driven by the Take Me Home participant. They are the driver of this vehicle. And so we, as the coordinators and as the program goes, whatever their desires and who they want to be on the team, we, most of the time can accommodate that. There have been some instances where they did not want the nursing home social worker to participate, and as we go through these slides, you'll see as that's really not really an option, but we can usually work through that. So to move on, many individuals can contribute to a safe and successful transition. The transition coordinators work with the resident to identify those individuals that they would like to participate in the process, and they'll help them organize that transition team. Okay, so each transition team will be unique, just as every participant is different, every transition is different, every transition team is different. So as stated, every transition team will be unique to that participant and should include the people who can provide input and support to the resident during the transition process. At a minimum, the transition team should include the resident, the transition coordinator, the facility social worker, and the home and community-based service providers once they are identified. And the nursing home social worker is key to this because they are there to help bridge that transition from facility-based to community. And the coordinator there is to help coordinate all these services. And we need those community-based providers to be ready to accept this individual when they transition day one. That's always our goal, is that services, everything be set up day one. Oftentimes it doesn't work that way, but we will have a plan in place to address that. The resident may also want to include family members and friends, and that is important to a successful transition. And that's fine. We have many participants who want their families involved. We've had, I can't tell you how many ex-husbands, ex-wives who were involved in transition processes. But also we've had residents who absolutely did not want any of their family members involved in the transition team, and that, that's their right. So we abided by that. In some cases, we're not able to avoid that because the family members that they did not want involved were living in the home that they were wanting to transition to. So we had to work that out. In some cases, we might have to bring in an ombudsman to help facilitate, which we'll talk a little bit more about the role of the ombudsman coming up in some subsequent slides. Other facility staff may also be included in the transition team. But again, it depends on the needs of the resident and their wishes. This may include, but are not limited to, the medical staff, therapists, dietitians. And again, it depends on the resident's need, what services they're currently receiving in the facility, how that's going to transfer over to the community, and can we do this in a safe and successful way? And so it does require the input of all these individuals who are providing these services to them in the facility now, and how that is going to look once they are in the community. And just as kind of a side point on that, there may be individuals that we work with who may be determined not to have capacity to make decisions. That does not matter. We will include that individual to make decisions as much as they can and involve them as much as they are able to. With that said, in those cases where they have been determined not to make medical decisions or quote incapacitated, then they will have some type of legal representative to assist them with that decision making. But again, it all is based around what that participant or resident desires. Go to the next slide. So the transition team meetings. While the individual team members will play varying roles throughout the transition assessment and planning process, it is recommended that the entire team meet regularly throughout the process to facilitate communication and address issues as they arise. Communication, as with really anything, is key to this program and really key to any successful transition. And so it's very important that anybody who sits on the team provide their input, talk about those concerns that they might have. I can't tell you how many times, we've received phone calls from family members with concerns about their loved one transitioning to the community. I would ask them, so well, did you bring this up in the transition team meeting? Well, no, I really didn't want to hurt their feelings or anything. I said, well, I understand that, and I appreciate you being sensitive to their feelings. However, If we're going to have a safe, successful transition, these points need to be brought up and they need to be addressed, because there's usually 9 times out of 10, there's a way that we can address any concerns that are there and hopefully work that out and incorporate that into a comprehensive transition plan. So at a minimum, the entire team should meet as soon as the transition assessment and planning process begins. And that is to answer questions and clarify expectations about the process. Expectations is a huge area where we have to discuss, because most folks that we are working with want out of that facility yesterday. And so as you can imagine, when you're coordinating all these different things, this can take time. Also, our program is at the mercy of other programs, timelines. We do not have control over when somebody can get assessed for waiver, or when they are financially determined and how long that may take. So those are just some of the areas on why we have to talk about expectations. Also, prior to the submission of a transition planning documents, this is to provide an opportunity to review all assessed needs and identified risks, as well as to begin the discussion about service options and potential mitigation strategies. As with anybody, when they're transitioning from the facility to the community, there are going to be risks. You cannot simply get rid of the risks. The risks are going to be there, but you can mitigate those risks so that the frequency of them coming up are less than what they are. And so the best thing to do is come up with some good, comprehensive mitigation strategies. And lastly, immediately prior to transition day, this is to ensure that the entire team is familiar with and supports the resident's transition plan, and to address any last minute or unresolved issues. I can't tell you how many times, we've had the folks have met, everybody's in agreement with the plan, but something changes with the resident or in the community or with their public housing. Something may come up that changes last minute that may have to be addressed. In some instances, it may cause a transition to be pushed back a few days. In other instances, it may just be a matter of getting some information from point A to point B to address the issue. The next slide. As I mentioned earlier, working with the long-term care ombudsman, any participant on our program has the right to include the ombudsman on their transition team if they so wish. I can just tell you the long-term care ombudsman and the regional ombudsman have been just invaluable partner with this program. We could not do a lot of the things that we do without their input and their participation. And so a big shout out to them. We do appreciate everything that they do. If you're not familiar with the long-term care ombudsman, we can provide you with a little bit of information here. The Older Americans Act requires every state to establish a long-term care ombudsman program. Each state's program looks a little different. In West Virginia, the state long-term care ombudsman is an employee of the West Virginia Bureau of Senior Services. Ours for the state of West Virginia is Suzanne Messenger, again, valuable team member. The Bureau of Senior Services contracts with Legal Aid of West Virginia to operate the regional long-term care ombudsman program. The mission of the long-term care ombudsman program is to enhance the quality of life, improve the level of care, protect individual rights, and promote the dignity of each senior citizen and or person with a disability of any age that is housed in a long-term care facility. And so that's when certain things come up. We may get referrals on somebody who has been given a discharge notice from the facility due to XYZ behavior or non-payment or whatever it might be. So we will have the resident tap their regional long-term care ombudsman to come in and advocate on their behalf. And it's amazing, how much time that can buy us to really get the plan together and get this individual transitioned home successfully and safely. So long-term care ombudsmen play a vital role in Take Me Home, particularly in supporting the residents of nursing facilities wishing to transition to the community. Specifically, long-term care ombudsmen provide information about Take Me Home and outreach to nursing home residents, families, and staff. make referrals on behalf of consenting individuals who are interested in transitioning to the community, facilitate introductions and ongoing relationships between transition coordinators and relevant nursing home staff. That's really a big one for us. Monitor the progress of Take Me Home participants in their preparation to transition to the community. Attend discharge planning, care planning, and other team meetings, as I mentioned earlier, as needed to identify needs and develop strategies for a successful transition. And investigate complaints related to Section Q or if a legal guardian opposes Take Me Home services. That last one, where a legal guardian may oppose Take Me Home services, that situation we run into is where we have an individual who really wants to transition to the community, but they are determined not to be able to make their own medical decisions and require some type of legal guardian or legal representative to make decisions on their behalf. In some instances, that individual or legal guardian may not be on board with them transitioning to the community. And that is really a prime example where the long-term care ombudsman can really make a difference and advocate on behalf of that resident. And so I just wanted to highlight that one right there. So is the ombudsman role different for Take Me Home participants? Short answer is no. It does not change for the Take Me Home participants. The long-term care ombudsman remains an advocate for the people who live in long-term care facilities. The ombudsman's role generally ends when the resident is discharged from the nursing home, and the long-term care ombudsman takes no action on behalf of any resident without the resident's permission. So, as I mentioned earlier, if the resident may have some type of issue with the nursing facility, with either a discharge notice or whatever it might be, we will advise the resident that they can ask the ombudsman to get involved. We do not contact the ombudsman for them because the resident must initiate and give that permission for that to happen. So I just want to make that clarification. So I think that works. So we have some contact information here. If you have any other questions or would like to research the Take Me Home program, our tmhwv.org address provides information about all the staff who work in the program, eligibility criteria, our contact information, just a wide range of information. I think we have success stories that are linked to there. So there's a lot of information. So I highly recommend checking out our website. You can make referrals two different ways. You can contact the Aging Disability Resource Network at 866-981-2372, or you can contact Sarah Martin here at 855-519-7557. You can also contact Marcus Canaday at 304-352-4220, or his email address there at marcus.canaday@wv.gov. And with that, I guess we can kind of open it up for any questions that you all may have. I'm assuming those will come across the chat box. So we've opened it up. We're taking a look here. But as we wait for some questions, some of the things, I would like to highlight. There's a lot of folks who are interested in the program that a lot of, providers even making the referral may say, I don't know if this individual will be able to live on their own. I don't know if this individual, can actually do it, maybe too risky. Well, we always say, go ahead and let's make the referral, because everybody's situation is different. We have so much, again, everybody's unique. You could have two of the same individuals with the same type of needs, but depending on their support system, one may be able to transition safely and successfully, and one may not be able to. So that's where the whole planning, assessment, and the comprehensive risk mitigation all comes in for each individual. Looks like we have something here. It says, mentions systemic issues earlier, wondering if you would expand on that a little. Can you clarify? I can, if you're talking some of the issues we're running into right now, staff availability from even in the nursing facilities, even at the community-based level. Part of, as I mentioned, we are, we don't have control of all the processes and timeframes that we have to depend on. One of those being when someone can access their home and community-based waiver services. Many times we can get somebody an apartment ready to go. We can get them approved medically, financially for a waiver program, and they go to select their providers for those waiver services. And what we run into, the providers may not have the hands-on care staff. And again, it depends on where they are wanting to move to in the state. That's a factor. And oftentimes it may just be the workforce availability. We all know right now there's a shortage of that, and there's a lot of different plans in place to address that staff shortage. But that's one issue that we're dealing in. Anything else that you can think of, Sarah? I know one big one is housing. We have a housing coordinator who is working with many of the housing entities to try to identify affordable housing for folks. Though West Virginia has a high homeowner rate compared to the rest of the nation, many of those homes are very old and require an immense amount of work to make them safe. And so that's an issue we run into many times. And so available and affordable housing is another issue that the Take Me Home program is looking to help address and educate folks on. So our housing coordinator, Esther Huck, again, if you go to our website, her contact information is there. She has a housing committee that she meets with a lot of the housing authorities to kind of address a lot of these needs specific to our program, and it does touch other programs as well.
One of the things I wanted to mention in regards to housing, the service that we can provide is home modification. And as Brian had said, a lot of the homes that individuals have are older, so they may need repairs. Well, unfortunately, right now, we cannot provide funding for repairs. So that's one of those things where, we sit down with the individual, we look at that and we say, okay, your home needs so many repairs. Is there alternative options for finding funding for that? Because as of right now, our program cannot do that. We can just do the modification, but we cannot provide funding for repair. So that's where, we really look at, is it worthwhile for them to repair their current home, or do we look at alternative options, apartment living where, it's more secure, everything's kind of more accessible, that kind of thing. So those are just one of the things that we do deal with. And the other thing, when we're talking about staffing, to kind of go back to even that earlier conversation, at one point it was specific areas of the state where it was a bigger issue with finding available staff, but with the staffing shortage, it's something that we are dealing with all over the state at this point.
Yeah. And going back to just mentioning the pandemic, it definitely affected our program and how our transition coordinators conduct business. As Sarah mentioned, we were doing a lot of things over video or telephone, and that has pros and cons to it, especially when you have required paperwork that, with signatures and things. So we had to really look at our digital signature process, and can we facilitate that? And so that was an area that we were looking at. But it did provide an opportunity with some telehealth. And did you want to talk a little bit about the telehealth participation with the CED?
So we worked during the pandemic. Actually, we started in 2020. We worked with the WVU to set up a telehealth program. It was a pilot program, and we worked with 36 individuals who transitioned home. and implemented a telehealth service. So out of those 36 individuals that asked to participate and that wanted to participate, we had individuals from WVU would contact them weekly. They were also provided equipment through another contracting company, things such as a tablet, so that way they could input blood pressures, they could input temperatures, they could input their weight, if that was an issue. So it was really, and it was ran over a 6-month period. So from the time an individual signed up until 6 months later, their information was recorded. We did find that some of the individuals chose to just do the communication through the telephone. They were not interested in utilizing the equipment, such as entering in their data on a daily basis or a weekly basis on the tablet that was provided. But they did answer the phone and talk to the nurse that would contact them and check in with them. We found some really good benefits from that program. Some individuals who may have went to the emergency room more frequently, or may have had additional, more issues with their health, medication related, whatever the case may be, are those nurses that we worked with or that worked with our participants were able to kind of head up or stop those issues before they became a bigger issue and before they had to be hospitalized. So we did have some good success stories that came from that. That pilot has been completed. They're doing some follow-up now, checking with all individuals who had transitioned home, regardless whether or not they participated in the telehealth pilot, just to kind of see, with the change of how society is, we are utilizing telemedicine more often, seeing that did work a lot during the pandemic. So do we continue it? For somebody who has an issue with getting out of their home and getting transportation to and from a doctor's appointment, could we call and check on them? If we had somebody to check on them weekly, or, if they had a monitoring system that could really log in and see, okay, how's their blood pressure? Is it fluctuating? How's their blood sugar? Those kind of things, and can work directly with physicians to make sure that their medications are correct, making sure that they're on the right medications, and that there's less crossover. There's not so many, you've got 5 different doctors and 5 different doctors are prescribing medications, and there's no organization of that information. So we're really still working with the WVU team to kind of coordinate it and facilitate and see what works and what doesn't work, and what's the best avenue. We did find, again, with the population that we currently work with, they were more likely to just do that phone call, less likely to really get in and utilize the technology. But it's been very informative and given us some good information.
And I guess before we close out, one other area I would mention is that we do have other partners that we work with as far as programs go, is the Olmstead program. Krista Davis is the director for that. And in some instances, if there's a need that our funding cannot be used for, oftentimes we may be able to tap into that program to assist with some of those funding needs. I know we've also done that with the CED's TBI program, where they provide funds for you.
Yes.
We've worked with them to provide funding for folks who are coming out under the TBI waiver. And so we really appreciate those partnerships, and we continue to reach out. And then one last area that I would mention that we are seeing a little more issue with right now is the availability of licensed contractors. If somebody is needing some type of, let's just say, bathroom modification for accessibility purposes, a lot of times, depending on where they live, it may be hard to find a qualified contractor to do those modifications. And in some cases, we'll work with some of the Centers for Independent Living to maybe if they know of any contractors that are in the area. And so our transition coordinators have really developed partnerships with a lot of the different entities in their areas. So that's we couldn't do everything that we do without those partnerships as well. So we appreciate that. I guess before we close out, is any other last chance for questions, comments? Courtney, is there anything else you need from us?
No, Brian, Sarah, thank you so much. There, in case you didn't see them, there's some wonderful comments in the chat about the wonderful information you provided. So just thank you so much, everyone. I did put a link in the chat. I'm also going to provide a follow-up email this evening in case you miss any of these training evaluation links. You're able to provide them at later on. But like they said, if you have any additional information, please reach out to any of us and we'll be able to help you out. And we look forward to seeing you at the next session, which starts at 2:45, which is on West Virginia ABLE, helping individuals with a disability save for today and invest in tomorrow.
Thank you, Courtney.
Thank you all.
Bye.
Wonderful presentation. Thank you.
Thank you.